so we're going to hit these Sata questions first. So the first thing that you want to do is you treat each one of the answers like it is a true or false, period. So anytime you're going to do a Sata, the best thing for you to do is just to cover up your answers and look at the question. Okay? That's what I would advise for any question, but especially for select all that apply. Okay? Just go ahead and cover up the answers, read the question, and you'll have a whiteboard or some scratch paper or something that they will give you to use for the Nclex. Okay? So if it helps you, you can go ahead and just make notes about everything that you know to be true or not true about that issue. Okay? Then you're going to go through each one and just do a true or false. So, Denise, so I'm going to go through the question with you, and then we're going to go through the answers. And for each one, just note if you think it's true or false and kind of speak out loud about why. So a client with a recent cerebrovascular accident is on a dysphagia diet. What does the nurse do to ensure client safety while eating? Monitor the client while eating.
True.
True. Why?
Well, because they already have a dysphagia diet, so which means swallow precautions.
Right. So you have to continue to watch them and make sure that their swallowing hasn't evolved and hasn't progressed to be something worse. Feed the client.
Whether it be myself or someone else, yes.
Why?
Because they do have precautions. So I would think it wouldn't be a care partner, it would have to be a nurse, right?
So what do you think?
I think false, because
Why?
just because they have a dysphagia diet doesn't mean they're not capable of feeding themselves. You don't want to take away an ability that they have to do themselves. So I think in just monitoring them, you're covering that base.
So did anybody infer that they also had other weaknesses?
I did, just because it was TDA possibly. I mean,
Right. So when we talk about reading into the question, that's reading into the question. They might actually, you can have a stroke and have almost no deficits. You can have just really mild cognitive deficits. So all we've said in the STEM is that they have dysphagia. They might actually be capable of feeding themselves very well, and they might be able to follow the directions for how to do that very well. We're just watching to make sure that they swallow appropriately, and that that they're not aspirating while we're caring for them. Place the head of the bed at 90 degrees.
True.
Why? Why wouldn't 45 degrees be okay?
I don't know.
Yes, you do. Why wouldn't what is the difference between 90 degrees and 45 degrees?
45 degrees.
That was the most literal answer ever. That was amazing. Spot on, man. 45 degrees.
If they already have a dysphagia and they may have problems swallowing, they're going to aspirate, and you want to keep them upright.
Right. So part of the dysphagia diet is also the dysphagia precautions. That's one thing that you actually can infer, is that they have to sit straight up in order to eat. So they have to be either sitting straight up in the bed or sitting straight up in the chair. Check for pocketing of food.
Yeah.
Yeah. Why? Why do I not trust them to not pocket food, but I do trust them to feed themselves?
They're having trouble.
because they're having trouble swallowing. If you can't get it all down, then you're probably storing it.
So
That could be an
something in here, right, is not working correctly. So it could be that they have nerves that are damaged, just some general muscle paralysis, that kind of thing. And they might not notice that they have pocketed food. So you do check to see if they've pocketed food. Yep. Offer thinned liquids.
No.
No, that one's pretty easy to get out of the way, right? Because what kind of food or liquids do we want them to have if they're on dysphagia?
Thicker.
They need to be thicker. Yep.